Hi everyone, hope you're doing well. Today we're going to be talking about World AIDS Day, which is today, December 1st, 2022. It's celebrated or recognized every year as a way to remember those who we lost to the HIV/AIDS ongoing pandemic, just to uplift their names, their memories, and then also refocus them on how we continue to fight this epidemic and continue to fight for people who are impacted by HIV and how to show up for them and how to continue to spread awareness and education around HIV and HIV health and what it looks like today in 2022, because I think a lot of us have old perceptions of what it means to be living with HIV, what it means to be diagnosed with HIV, and a lot of that is stuck within the 1980s and 1990s understandings of HIV, just given that a lot of things happened that kind of shaped. Hey, Paul. Hope you're doing well. So, during the COVID-19 pandemic, the department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Again, today we're going to be discussing World AIDS Day. Before we jump into the conversation, I want to take a moment of silence for us to remember all the lives that were lost and continue to be lost due to HIV and AIDS and the pandemic. Thank you. So, a little bit of information about World AIDS Day. It was first observed in 1988, and World AIDS Day is a day to unite to help end HIV and remember those lost to AIDS-related illnesses. The day is often recognized with candlelight vigils and uplifting memories of lost loved ones, and also visiting the National AIDS Memorial quilt sites, whether it's a physical or digital location. You can visit www.aidsmemorial.org/quilt to search different names on quilt panels and see where you can see a physical quilt in person. The National AIDS Memorial shares the following history on the quilt. So the quilt was conceived in November of 1985 by longtime human rights activist and author and lecturer Cleve Jones. On October 11th, 1987, the quilt was displayed for the first time on the National Mall in Washington, D.C. during the National March on Washington for Lesbian and Gay Rights. It covered a space larger than a football field and included 1,920 panels. The quilt essentially is different quilt panels, or like 6 foot in length or width, depending on which way it's oriented. Panels that offer like a memory reflection of someone who has lost HIV and AIDS. So if you think about, each quilt has about 6 different panels on it, so recognizing 6 different people, and the fact that there was 1,920, it's just a huge quilt. So in 1989, a second tour of North America brought the quilt to 19 additional cities in the United States and Canada. And that tour and other 1989 displays raised nearly $250,000 for AIDS service organizations. So that's really incredible. Again, this is just like human creativity and dedication to wanting to support communities who were very much in need, because there just wasn't enough being done for people who were impacted by HIV and AIDS during that time. So in October of that year, the quilt now had more than 12,000 panels in its size, which again speaks to how fast HIV and AIDS was spreading, how many people it was impacting, and how rapidly people were dying from being impacted by HIV and AIDS. So it went from 1,920 panels in 1987 to 12,000 panels in 1989. So it was displayed again on the Ellipse in Washington, D.C., and HBO actually released a documentary film on the quilt called Common Thread: Stories from the Quilt, which brought the quilt message to various people's eyes and ears and hearts. And it actually ended up winning an Academy Award at the Oscars for Best Documentary in 1989. In 1992, the AIDS Memorial Quilt included panels from every state and 28 countries. So again, it's growing rapidly because of how many people are dying from AIDS-related complications. And in October 1992, the entire quilt was returned to the National Mall in Washington, D.C. In January 1993, the Names Project was invited to march in President Clinton's inaugural parade, where over 200 volunteers carried the quilt panels down Pennsylvania Avenue. And so the last display after that display and that tour in 1992, the last display of the entire AIDS Memorial Quilt at one time was in October of 1996. And the quilt covered the entire National Mall in Washington, D.C. with an estimated of 1.2 million people coming to view it. The Clintons and the Gores attended the display, marking the first visit by a sitting president of the United States. And that particular fact also speaks volumes because it took President Reagan, who was, I think, in office when HIV and AIDS first kind of hit the scene in terms of public health, to say anything about it, because folks just didn't care that people were dying, but because it was mostly gay people who were dying, and mostly just communities that folks, I guess at that time, preferred to see that way and not support whatsoever. So that's a little bit of history about the quilt. And again, just think about the size of it and the amount of lives that had to be lost for it to cover the entirety of the National Mall. So on to this year's themes and efforts around World AIDS Day. According to HIV.gov, this year's theme for World AIDS Day is putting ourselves to the test, achieving equity to end HIV. It encourages people to unite globally to eliminate the disparities and inequities that create barriers to HIV testing, prevention, and access to HIV care. According to CNN, on this World AIDS Day this year, the Biden administration actually renewed its focus on ending HIV and AIDS and the epidemic by 2030. So they released a new 5-year strategy for the United States global response against HIV. The administration also said that it's accelerating its response to HIV and AIDS with new global goals, including reaching key treatment targets across ages, genders, and population groups, supporting UN AIDS target to reduce new HIV infections, and closing equity gaps for certain groups, including adolescent girls, young women, and children. So now we want to talk a little bit more about what we can do to fight HIV presently today as individuals in our own lives and in our communities. So to end inequities in HIV, we must increase education about HIV and testing and treatment and prevention and what those things look like. So today in 2022, HIV is a manageable chronic disease. It's no longer a death sentence or the death sentence that it was back in the early 80s and 90s when people just weren't funding research behind it and people had to have HIV walks and AIDS walks to raise money because the government wasn't helping to do so at that time. We are thankful for so much more investment from governments and leadership now. But again, today, HIV is a manageable chronic disease, and it's more preventable than ever before. And it's just important that you get tested regularly and know what your HIV status is, because that informs how you kind of proceed forward in terms of your HIV treatment plan or your HIV prevention plan. So for a sexually active person who doesn't consistently use condoms or barriers, it probably looks a little bit like getting tested every 3 months for HIV, because it can take up to 3 months for your HIV test to come back positive after a possible exposure to HIV. For someone who has a history of STIs or testing positive for gonorrhea or chlamydia or syphilis, this may look like getting on PrEP. So this is pre-exposure prophylaxis, which is a preventable pill or injection that can reduce a person's chance of contracting HIV by 99%, or about 99%, should they come in contact with the virus. This looks like a sexually active person knowing that PEP, or post-exposure prophylaxis, exists and knowing what it is. So PEP is like kind of the Plan B version of birth control, but as it relates to HIV prevention. So instead of preventing pregnancy or unplanned pregnancy, it prevents HIV exposure or HIV contraction. So PEP or PEP is a 28-day course of medication that can prevent HIV after a possible exposure to HIV. It has to be taken within 72 hours, similar to Plan B. But yeah, it's got to be taken within 72 hours of exposure to HIV to be effective. And so PEP is for emergency use and is available at Whitman-Walker. You can call the PEP line at 202-797. Sorry. You can call the PEP line at 202-797-4439 or walk into their 1525 14th Street location or their 2301 Martin Luther King Jr. Avenue location in Anacostia. PEP is also available at emergency rooms again because it's an emergency drug and it's needed to be taken within 72 hours of exposure. That's whether the sex was consensual or not consensual, or they were exposed through needles and works. That option exists as well. Time to talk about World AIDS Day and what the day means and how you can recognize it, and just the history of HIV and AIDS. Before we go, we wanted to share a few reminders about HIV and STI prevention and testing services that are available through Whitman-Walker, who has been on the scene fighting HIV and AIDS since the beginning, since 1981, before, because they were doing STI testing before HIV became a thing. But again, before we go, you can learn about Whitman-Walker Health's testing hours and locations at www.whitman-walker.org/testing. HIV and STI testing are available by appointments at Whitman-Walker's locations. Again, this is the Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast, and the Health Center on 14th Street, which is at 1525 14th Street Northwest near Logan Circle. You can call 202-797-4439 to schedule your HIV or STI testing appointment. And if your community or your organization is interested in Whitman-Walker providing mobile health services in your neighborhood, you can contact mobilehealth at whitman-walker.org. Again, that's mobilehealth at whitman-walker.org. You can access HIV prevention tools like PrEP or PEP or PEP, or start treatment for HIV with Whitman-Walker Health at the Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast, or at Whitman-Walker at 1525 14th Street Northwest. And in this day and age, fighting HIV also looks like knowing that treatment as prevention exists. So if you are positive and living with HIV, you can always take treatment as a way to prevent new cases of HIV. So if you're a person who is adherent to your medication, you're taking it as directed, and you achieve an undetectable viral load, meaning there's too little virus or HIV virus in your system that you can't pass it on to another person. Like you can't sexually pass it on to another person. So that's a really amazing thing that is present and happening and possible to say because of years of activism and research and raising funds and eventually receiving government funds to fight HIV. But yes, if you're out there and lighting a candle and saying you're loved to AIDS related complications. So I hope you're recognizing this World AIDS Day. Before we go, here's some information and reminders about COVID-19 and vaccines. If you've already gotten vaccinated, thanks so much. Congratulations, you've taken a really important step toward preventing yourself and your loved ones and your communities from illness. Multiple variants have spread across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine is not 100% effective at preventing new cases of COVID-19. It's very effective at making sure you don't die from COVID-related complications, you don't end up in the hospital with COVID, and that you don't get very, very sick with COVID. But all in all, keep staying alert, as there's, again, very few protocols in place to, one, keep mask use up, and to verify that folks have been vaccinated or not. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. You can call 202-207-2480 to make an appointment. Again, that's 202-207-2480. And if you're having trouble making an appointment not close by, you can always, as a DC resident, you can always go to vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you are a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you're getting the vaccine and discuss COVID precautionary measures with those who are around you, but especially be mindful of masks and keeping your distance when you don't know whether folks have been vaccinated or not. According to the CDC, because we're also battling monkeypox, there are 29,000 cases of monkeypox documented in the U.S. If you're in DC, you can pre-register for monkeypox vaccine appointments at preventmonkeypox.dc.gov. And Virginia has been working with local care providers to contact, trace, and identify those who are most in need of monkeypox vaccine. And the Maryland Health Department released a pre-registration system, so you can visit the Maryland Health Department website or your local health department's website and see how they're distributing monkeypox vaccines. For DC, monkeypox vaccinations are available first come, first served. Again, to eligible residents, and the hours and locations vary. So just preventmonkeypox.dc.gov to see where the locations are, what the hours are, and how you can get vaccinated. Please remember to follow Whitman-Walker on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website at www.whitman-walker.org for the most up-to-date information on their services and for more COVID-19 resources and general information on Walker's services. Give them a call at 202-797-4439. Again, that's 202-797-4439. With. Please also follow some programs and Whitman-Walker family at RealTalkDC _ and at NoFilterDC. Hope you all have a wonderful rest of your day. Good night.